The Science of the Positive, Growing Health with Positive Community Norms and Hope. And just a real quick note, I'm Dave Clausen, the director of the Mid-America Prevention Technology Transfer Center. I'll be your host for today's session. If you have any technical difficulties, feel free to send me a message in the chat box and we'll see what we can do to get that fixed for you. We do ask that you stay muted for most of the duration of this web workshop. However, we do have some engagement and some time where we will like you to unmute and share your voice. And a quick little disclaimer, although funded by SAMHSA, the views expressed in this workshop do not necessarily represent the views, policies, or positions of SAMHSA. And just a little bit more about us, the Mid-America Pttc for short. And yes, Mid-America Pttc is the short version. At the Mid-America Pttc, we're tasked with providing substance misuse prevention, training, and technical assistance through Missouri, Iowa, Nebraska, and Kansas. Now, this really means strengthening and supporting organizations' efforts to implement evidence-based prevention strategies, ultimately promoting safe, healthy, and drug-free communities across the region. And many say collaboration is a key to effective substance misuse prevention, but we strive for something stronger than collaboration. You know, the act of working together with somebody to produce or create something. But what we want is community. You know, we want that fellowship with others as a result of having those shared common attitudes, interests, values, and goals. From a rural town to a one-person's prevention team, to a county coalition, clear up to the state level, we're all on the same team. And the more we come together to support each other on the mission, the more we can create healthier and safer communities across all of our states and our regions. And at our core, we believe prevention is better together, and that together we are stronger. And the Mid-America Pttc is housed at ACT, Missouri. And quite frankly, ACT Missouri has been serving communities at the grassroots level for nearly 30 years. And I'll take a quick little side note and turn it over to Chuck Doherty, my executive director of ACT Missouri, and he's going to share just a little bit about ACT Missouri for you. Chuck, it's all yours.
Thank you. As Dave said, we've been in business for nearly 30 years. We've been serving as a substance abuse prevention catalyst, providing training, technical assistance, and consultation to coalitions, schools, and substance use professionals, in the hope to empower and foster partnerships and collaborations that promote safe, healthy, and drug-free communities. Just recently, as Dave said, we expanded our reach to include the Region 7 and implementing Mid-America Pttc. And I'm glad you all could join us and we can offer this to a regional group. Thanks for coming. Back to you, Dave.
All right. I want to take just a little moment and reflect on the power of words. We're all prevention leaders in our teams, in our communities, and in our field. And together we can use our words to really create that positive change, because words do have power. And we can lead by example and really drive that change. Just a quick little moment to reflect on that. And two more things. We've got a couple of highlights. We've got our webinar coming up on August 25th for our PFS Academy, talking about cultural competence. And for those that are real fun and tech savvy, we've got our Mid-America Pttc podcast and some short roll call videos, YouTube videos that are anywhere from 10 to 15 minutes long, because y'all are busy, but we still want to be able to provide some great content and information for you. Now, in this day and age, we're all mostly comfortable on Zoom, but I wanted to provide just a quick little orientation to the Zoom platform in case we have anybody new joining us that might not be as familiar or comfortable with Zoom. On the bottom left-hand side, you'll see the mute, unmute button. Next to that would be your camera controls to stop or start sharing your camera. Then continuing towards the middle of the screen at the bottom is the participants button. When you click that, you'll get the list here on the top right where my name is shown. The bottom of that participant list would be the reactions. You can give us a thumbs up, a thumbs down, a slow down. You need a break, you have a question, because we're monitoring that and watching for those cues. There's a chat button as well back in the middle of the screen at the bottom. We'll be utilizing that chat box on the bottom right-hand side of your screen throughout this session. So please don't hesitate, jump in there. There might even be two conversations going on at once, the main presentation and the chat box. And if you need to change the layout, that's where you look here at the top, speaker view. You can click that to see everybody's webcam or change it to where it only shows one person. And that is your quick orientation to the platform. And again, I'm Dave Clausen, and I will see you in the chat box. And with that, I am very excited and very honored and looking forward to today for quite some time. Really just looking forward to the chance, any opportunity to work with Dr. Jeff Linkenbach from the Montana Institute. And with that, let's get into today's web workshop. Jeff, I'll go ahead and stop sharing and turn it over to you.
Thank you, Dave. Thanks, Chuck. It's an honor to be here. And I love the representation that we've got on this meeting, people from everywhere, from Hawaii and Kansas and Minnesota. I see some Minnesota people, so Missouri. So this is great. Thank you, everyone. My passion in the work that I've been able to do has been studying norms and studying the science of the positive. And we're going to unpack those elements today in more detail. And we're going to also unpack some elements of what we call hope. But to start off, I wanted to say, I love this quote from a great Lakota leader and prophet, about us putting our minds together to see what kind of future we can create for our children. And I'd like to dedicate this training, this webinar that we're doing together, to the next generation that many of us are serving. You can come to my website, our team's website, and pick up a lot of the publications and things that we're going to be referencing today. And I've just been talking with Dave and Chuck, and we're going to put together a package as well and be able to fire some things off to you. So if I mention something, or if you're wanting more about that, you could jump into the chat box, ask Chuck, and he'll be getting that. So we're going to follow up with an email with some of these different materials and publications and links for all of you. This year we did not, for the first year in 26 years, did not have our live event at Big Sky, Montana, which is unfortunate. Dave and Chuck were joining us at that event as well. But every year our premier event is the Montana Summer Institute in Big Sky. My daughter just emailed me a picture from this exact meadow last week, and it looks this way right now with the different wildflowers blooming. So would love to have you join us. And we also do a pre-institute at the beginning of the web at the Summer Institute that goes deep diving into some of these kinds of issues as well. We're also gathering, and Dave, if you don't mind, maybe throw this URL in the chat box. We're starting to gather some information on what people want to hear more about. I'm going to be hitting some of these topics today, but would like, if you want to get more information, more trainings, would love to hear about this. And then I'll be looping back as well with Dave and Chuck to coordinate these as well if we get enough people that are interested in these. Here's what we're going to do today. We're going to jump in and talk about this framework, the science of the positive, and unpack some of the key elements there. We're going to look at one of the main applications or spin-offs of the science of the positive, which is another framework known as the positive community norms approach, and focus on looking at perceptions and misperceptions of norms. And I'm just going to touch on and introduce some of the research and this other framework we've been engaged with Tufts University School of Medicine, which is healthy outcomes from positive experiences. And we have a webinar that Mid-America Pttc is hosting tomorrow on this topic. And so we'd love to have you join us for that. And then we'll do some reflection on what we're learning. But first, I'd like to know, if you don't mind, jump into the chat box, if you would. What's something positive that you've experienced this week? We talk about the science of the positive, and it's important to jump in and be able to focus on some of those things. So what are some positive things you've experienced this week? Love to have you just jump into chats. And Dave, if you don't mind, go ahead and read some of these things off that you're seeing.
Yes. So we got one person that cooked. Susan's asking, in general or related? I would say in general is my guess. Oh, got some beautiful weather. Husband recovering from knee surgery. That's definitely something positive. Quality time with the family. Sleeping better. Lost a few pounds. A socially distanced concert. Awesome training this week. I'm going to just pretend that's talking about this one. Connection with family. Oh, I love connection. That's what we're all about. Community and connection.
Yep, I saw that, connecting with a grandmother. I love the fresh tomatoes from the garden. Love that, absolutely. And oh, you got to swim with a manta ray. Oh, that's really cool.
Yeah.
Double rainbow over the St. John's River. Oh,
That is.
yeah, sunsets, seeing mom. So connections with people, connections with nature. So important for us right now. Connections with our family. So thank you, everyone. I see more of these too, but it's just so important. And so when we jump in and start to explore what we talk about with the science of the positive framework, I'd like to do something right up front here. Make sure you're on mute if you would, for what I'm about to ask you to do. And I'm gonna bring this up, something on the screen, and not here, but the next word that appears, make sure you're on mute. I want you to shout out what you see as the next word that appears. Okay, you ready? Shout. So what was it that you said? I want to know. What is it that you said here? What did you see? And what did you say? What were some of the things? Nowhere. Yep, nowhere. Host has us muted. Yes, he does. That's good. Nowhere. Yeah. Interesting, isn't it? Yeah. We're seeing that, right? So this is a great segue into what we're going to be talking about here today, in terms of one of the major elements, or one of the big themes that we're going to look at is the role of perceptions, and who we are, and the role perceptions play in ourselves and in our work. So yeah, we could look at the fact that the positive is now here, available right here in this moment, or we might see that the positive is nowhere to be seen, right? So which is it? Well, it's both, is it not? I mean, we get that, right? So we talk about what is the science of the positive? It's really a study and a focus on positive factors and how they impact us collectively in culture and personally with our experience. And then we're going to go and bore down into that and look at how we can measure and grow the positive. And it's all based on this core assumption that the positive is real, that it exists, and it's worth growing in ourselves, our families, our workplaces, our gardens with tomatoes, right? And it's something that has a value that we can share. So in starting into this conversation and this journey together, I often like to ask this question, and that is, we think about Dr. King's amazing skills. I had one speech in particular that sticks out to many of us, right? And he said, what did he say? He basically said, I have a what? What? Right, a 7-step strategic framework that's evidence-based, it's comprehensive, multifaceted, and it works across the social ecology, right? Is that, well, okay, all right. Maybe not. Maybe this was the pre-edited version that he might have said. No, of course not. He didn't start with a strategic focus of science. He started from his heart. He started with, I have a dream, right? And so effective transformational leaders get this. They do this all the time. They start with spirit. It comes from the heart. It's spirit first. I have a dream, he said, right? And we see this with, and so this connects for us with this core assumption in the science of the positive. And through this research, boring down into layers and layers and finding out below a lot of our thoughts and our beliefs and things that we're aware of, we have these assumptions that operate, and even deeper there is a core assumption. And for us in our work, this core assumption is that the positive exists. It's real and it's worth growing. So it exists in each person, each culture, each community. So this is a radical shift for some of you maybe. It sure was for me. I wasn't trained to think this way. A lot of my training came from counseling and more of a medical model, which was to identify and label, and in particular to look for problems or deficiencies, more of a deficit-based approach. But what if we look through a lens that's positive, realizing that the goodness and the positivity and the protections already exist? And it means at the community level for us, the solutions are already in the community. The solutions are there before we arrive. It doesn't mean that there's not problems. It doesn't mean that there's not issues. We're gonna dig in and talk more about that. But it radically shifts our role in the work that we're doing. I came into the prevention field out of the treatment field, actually. And a lot of what we did at that time were scare tactics. You know, we thought we could scare the health into people, right? And we'd use all sorts of approaches. But there were many of us that, and I bet there's some of you in this workshop too, that have found using the scare tactics actually had an iatrogenic effect. It actually had a boomerang effect, right? And we see that with a lot of the research and data, that using fear or shame can actually backfire and actually make the problems worse. We saw that on college campuses and in some of the late 1990s with the work we were doing. And we were really marketing with, listen to my language here, our goal was to raise awareness of the problem. Our goal was to raise awareness of how widespread the problem was, how widespread the harm was. So we were intentionally trying to impact perceptions that this thing is everywhere. We didn't know it at the time, but that's what we were doing. And so we saw spikes in some of our data and had to really start to look at what we were doing differently. We came to understand that if we want health, we actually need to focus on and promote health. So here's one of those underlying action elements for us with this work. If we want to see increases in health, we're going to need to cultivate conditions for health. We're going to need to have messages of health. We're going to need to find ways to grow health. So what we focus on actually grows and expands. It starts to pull an energy in there to it. So what we focus on starts to have that energy and starts to expand. If we want to increase health, we're going to need to find ways to focus our attention, our perceptions, and our resources on health if we want to grow health. We do that through the science of the positive framework. We're not going to unpack all of these elements today. We have other trainings and documents and resources, that some of which we'll be sending you about this. But I want you to understand a few things. We always start with the center here in terms of the positive, that the positive exists, it's already there, and then we're going to find ways to uncover and unpack that, liberate it, if you would. We have these different steps and actions that we take. And look on the outside. This is something we are going to spend some time with right now. We have this cycle that we go through of spirit, science, action, return. Spirit, science, action, return. We're going to unpack that. We call that the cycle of transformation. And that's at the heart of all the work that we do. And so when we do this, there's a lot of different ways that we can think about these words and in different contexts, right? Talking about it right here in terms of this Zoom webinar, you might have certain ideas or words that you associate with spirit. But if I was talking to you from a synagogue or a church, might have a different understanding. Same with science, action, and return. And so we become very intentional and strategic about how we would look at these words and how they start to play out through this process. So one of the things that we'd like to do at this time, and using the chat box once again, I'd like to do this. I'd like to do some word associations. I'd like you to jump into the chat box. And what are some of the different words that come to mind for you when you think of the word spirit? Let's just start with that one first. What are words that come to you when you think of the word spirit? What things show up? You can use the chat box and start to think about that. Dave, you could read some of these off if you don't mind.
Yep. Holy, faith, animals, angels, energy, old wisdom, being present in the now, soul, wind, calm, hope.
Love that. Listen to the power of these words. And the positivity of these words as well. Let's talk about science. What are different words that come to you that you associate with science? And you can say more than one if you want. Go ahead and jump in the chat box here still. Science words now, science associations, facts, research, facts, data. Dave, what else are you seeing?
Evidence, research, evidence-based learning, nerdy, concrete, biology, logic, data, cold facts, and experiments. Proven.
Some logic, fact, proven. Sounds like Spock on Star Trek, right? High school. This is great. Yeah, high school. I love that. I haven't heard that one before. Theory. That's good though. Logical, reliable. Yeah. And listen to the context of these. I like this. Slowly. Projects, try again. Resolute solutions. What about actions? What are words that come to you that you associate with action? What are some action words, folks?
Doing, movement,
Yeah.
moving, run, activity, dance. I like that. Oh, look at them all. I can't even read them that fast. Exercise.
Love it.
Active, physical, eat, work, music, chat.
Yeah.
Read, energy, go.
Love it. Love it. And what about for hands-on works? Yeah. What about return? So we go spirit, science, action, return. What are some words that you think of that you associate with return, the return?
Come back to home, tennis, refocus, closure, balance, sever, receive, start over, home, cycle, to God, results, give back, undeliverable, and I don't know how to pronounce that one.
Hanahau.
Hanahau. All right.
This must be Hawaiian.
Yeah. Being present.
Native. Yeah. Being present. Love it. The return. These are great. So once again, in this one as well, look at the diversity of some of the responses or associations we have. And I think that's one of the things that's really important here for us to recognize. We may come into this and go spirit, science, action, return, and have our own view, our own experience and perspectives. And what's important is for us to hear the breadth of other associations that people have with these words, and would maybe have very different ones in other contexts too. One of them I heard for return one time in a workshop was a Walmart. You can always return anything you buy to Walmart. So okay. So again, so the diversity of that. So thank you. So I appreciate that. What else did you hear? Go ahead and still in the chat box if you don't mind. What else did you hear or experience from this activity? I always like to kind of have that moment to reflect on what we just did. What did you learn or experience? Use your chat box if you would. But yeah, Wendy, I agree. There's not one right answer, that there is a reflection. Yep. I like it, Susan, that people are hopeful and resilient, and there's different perspectives. Thank you. Yeah. Broad scope of definition. Absolutely. Yeah. And thank you. I think that's great. You have to provide a definition if you want to make a statement, and that there's diversity and relatability. And this would work for a Native coalition is one. Absolutely. We do this a lot with different Native communities, indigenous communities. So yeah, thank you. I think and the other thing I'm doing here is modeling something. I think it's important whenever we engage in some kind of an activity, at least where we can, providing that opportunity to reflect back as adult learners. I think that's something that we really value. So what does this mean? So we start taking this cycle of transformation and we start applying this in all sorts of ways. We're actually redeveloping a strategic action process for a state right now that's based on these four, and saying they wanted something more simple and straightforward. And so they're using this framework, but we'll do it in terms of messaging. Many of you in prevention are probably involved with some sort of communications or messaging, or need to get out and do talks. So we'll frame some of our questions like those you see here. What would be the spirit or the tone of the message? Staying with that one a little bit more. What is the spirit or tone or emotion that I'm trying to convey? What is it I'm hoping the audience is picking up? Right? Are they picking up what I'm laying down? Right? If we start to get into strategic communications. So we're going to be really intentional about spirit. Is it a spirit of connection and safety and nurturing? Or is it a spirit of fear, for example, or threat? Right? I mean, it's really important for us to think, what is it we're really communicating? And then we look at how to approach the science, and the science then leads the actions in terms of data or evidence, best practices. We always come back to that place of reflection. What returns are we seeking? Where do we want to be at the end of the process? So our work, we look at this thing about the positive. And one of the nice things about focusing on the positive is that it really brings a sense of hope. And I think in these times, that's something that we're hearing a lot of, that we're really hungry for hope. We want to find ways to experience hope. If we think about if I really oversimplify public health, it really works with what we call red arrow, green arrow, right? We can just look at it that way. Public health is just red arrow, green arrow. We're trying to grow the green arrows, and we're trying to shrink or reduce the red arrows, right? I mean that's really what we do. The science of the positive, we talk about it in terms of hopes and concerns. We're going to try and increase the positive and the hopes. We're going to try to reduce the concerns and the risks. Here'd be an example. What are, just without really looking at the wording for a moment, just look at the image. What are some words that come to you in terms of the spirit or the context of the work? What are some words that come to you for the image on the left? Go ahead and, again, use your chat box if you would. What are things you're seeing in terms of the image? What are some words that show up for you there?
Shaming, humility, hopeless, sad, defeat, hopeless, slow death, danger, fear, ill, sad and scary, and wounded.
Suffering, yeah. And listen to the nature of these words, that the tone, it's about suffering. It's heavy, it's hurtful. It's sad and scary, like you said, and wounded. What about the image on the right? What are some low self-worth, right? What are some of the spirit or contextual words that we think about with the image on the right? Connected, supportive, happy, friendship. Listen to these. Friends, love, possible, uplifting, together, not alone, friendship, absolutely. Support and positive, happy. So listen to an image alone, hope. Thank you, Amy. Image alone can really communicate a spirit or a tone right away before we even look down into data, message, facts, sponsors, anything else, right? So I think we always think about spirit first. We want to be very cognizant about what we had said earlier, and come back to this, that if we want health, we're going to need to focus on and promote health, right? If we want to focus on growing the positive, we're going to need to be thinking about and utilizing messages and images that communicate that sense of positivity that we want to grow. Here's an example of something that showed up with one of our projects in Minnesota. Happened to have all 4 of these elements on the side of a bus, right? It's interesting. There's a spirit of gratitude, of thanking parents, for example. This is a normative message. We're going to unpack more of this. The science of a norms message, showing that there was some data, and the action, and then, you know, what would be the returns or the outcomes. So interesting that you can have all 4 of those in its most simplistic manner show up like this. Yes, you'll have a copy of this. We're going to make sure you have PDFs of these slides, so you don't have to write that stuff down, y'all. I want to make sure you have it. So, but just a great example there. A lot of the work we do with coalitions, we teach them how they can start to think, speak, act, and operate in this way. And so, like in Minnesota, we work with 10 communities at a time in 5-year cohorts. And one of the things that those communities do, the state has them learning how to develop their coalition meetings and their agendas based on this framework. So what's the spirit or tone that we really want to communicate and experience at the beginning of the meeting? Then we can unpack some of the science and the data, get into the actions, and then look at the returns. So really unpacking and utilizing this in many different ways. So this really starts to become an operating system, if you will, for the work that we do, for messages, for organizing, and for thinking about our work. And then we come around and we start to ask, you know, are we getting the results we want, right? And so if, you know, are we seeing this growth in positivity and in healthy norms, or improving health and safety, increased protections? I want to ask you, what are some of the things that, if you think about your green arrow, and so this would be saying you want to see increases in this, you want to cultivate this, you want to expand this, you want to grow this. What are some of those things you want to see in your communities? Once again, if you would, you know, you could use the chat box and report on some of these. Dave, do you mind?
Community connectivity. I agree. Our PTTC motto: build the community to build the capacity. Yep. Posters of success stories in our community. Cool. Healthy families. Family attachment. Parent involvement. Access to services for people of color.
Yep. These are
great parents and better communication. Meaningful connections.
Yeah, you people get it. I love it. Yeah. And feel the energy as you hear these and as you type some of these. Something very powerful about focusing on what we want to grow. what we want more of, what we want to create room for, what we want to cultivate. Love this, Amy. Success stories about prevention in schools, positive, healthy modeling by parents, getting resources and growing resources in rural areas. Yeah, increasing disability mental health services. Yeah, and thank you. Sometimes it's hard to frame it in a positive way. Thank you for saying that. You're not the only one thinking that. And so I want to thank you for mentioning that. A lot of the way we're trained is to look for deficit. So and to look for just focusing on reducing that red arrow. So this can be a shift and a very intentional one. Yeah, so thank you, everybody, for jumping in on this. We're going to continue with this. And part of what we're doing, we start to build off of that science of the positive framework. And then you'll see a lot of the same similarities here as you start to study positive community norms approach or framework. And now, instead of it just being the positive in the center, it's actually going to be positive norms, which are so many of the kinds of things that you all just mentioned, and we could develop as ways of measuring those as positive norms. We're going to grow these positive norms around what's called the social ecology. How many people have heard of that term before? Uri Brofenbrenner is the author. I just like to say his name too. From 1979. And it's also a really cool thing. If there's like one thing you get out of this presentation and your partner or spouse or friend asks you, so what was that about? You could just say, you know, we were talking about Uri Brofenbrenner's social ecological framework. And talk about that for a conversation starter, right? It's like, okay, they're gonna lean in and go like, tell me more. Or not. But anyways, a social ecology is basically a system, right? It's like a nesting of systems. You have an individual that happens to be in a family, that happens to be in a school, in a workplace, in a community, right? It's a system. And we have these steps, these 7 steps for how we do it. And we're going to unpack these other things that are going around the outside. But first, what I want to do is jump into something else. And Dave, I'm going to ask for your help here because it's survey time. Dun, dun. We need music here. Chuck, can you sing some of the survey time music? You're on mute.
I'm on mute. I can't, however.
Okay.
Sorry.
Just wanting to make sure you had that opportunity in case you wanted.
I appreciate that.
Okay, all right, so survey time. So here's the first question. Can everybody see the question? Yeah. I don't have, you can see it up here in that box. Have you started to practice a new hobby or skill in the past 4 months? So this is kind of a bit of a warm-up question here. And I'm going to intentionally unpack some of these things using language for teaching. You'll see what I mean. Wow, look at this. 87%, 84% of us, 8 out of 10 of us, we got a norm here. We got a, right? 8 out of 10 of us have done that. So that's great. So we can kind of just end that and share the results. Thank you, Dave. Perfect. So yeah, so just reflecting on that. So just move to a next one here. Next polling question. Again, kind of a bit of a warm-up question. We are not seeing your names attached to your answers. Okay, so as a research scientist, I need to say, okay, your participation in this survey is voluntary, right? Any results are going to be reported only in aggregate, right? Okay, but look at that neat little semi-bell curvy thing we got going on there. Just to see a bit about who we are, results pointed, reflecting back. Okay, great. Okay, now that was just a bit of a warm-up. Now what I want to do, it's kind of fun, is I say, so what does that mean? Where do we go with it? Here's where we go. I want to ask some of these questions, and we're going to unpack some norms related stuff here, and as well as some other elements. So first, did you know that flossing your teeth daily can help prevent disease? So did you know that flossing your teeth daily helps to prevent disease? I'm just going to stay with this for a second here. And so we're going to see, so right now, and you all can see this too, and Dave, you can end the polling once you see that everybody has come in here. So what we've got is 90% saying yes. 10% of us, however, said no. So there's a number of things we could do right away with these data in terms of prevention and health promotion, health education. First of all, the majority of people have this knowledge of this protection. However, not everyone does, right? And so there is a need for us to still get out some accurate health information around this particular topic, right? You follow me? You hear the justification? Although we probably don't want to put, 90% of our budget into just raising awareness of the issue. But that's something important of where we're at. Let's go to a next question. We're going to unpack some things here. Do you think people should, let's go to this next, yeah. Do you think people should floss daily to help prevent disease? Do you think people should floss? So now we know that flossing daily can. Should they floss? And most people are coming in here. We're almost done. And yeah, so we'll go ahead and end that. And now what we have is 94% of us think that people should floss. And then there's 6% that don't know for whatever reason, aren't sure. I actually, as a researcher, intentionally create middle categories like neutrals and don't knows. There's a lot I think we understand by having that in some of our surveys around whatever the topic is. And that unpacks more at times, as we'll see. So we'll keep going. We'll keep going with this. We got a story unfolding. So the next question here is this. Did most people on this phone call, in this web workshop, floss their teeth in the last 24 hours? So did most people floss? So this is an example of a perception of a norm. That's what we're doing here. This is a perception of a norm. And I'm letting you have a little more time here to answer this. And so we could close that one out too. I think we're pretty close. And interesting, isn't it? The plot thickens, people. The plot thickens here, doesn't it? Now, we've got 54%. Most people in this workshop perceive that most people in the workshop did not floss. You follow me? Do you hear how I said it? 54% of us, more than half, think that most people in this workshop did not floss. That's the perception of the norm. Okay, guess what our next question is? Yeah, you got it. Okay, so now let's look at this next question. In the past 24 hours, did you floss? In the past 24 hours, did you floss? And close it out whenever you want. Interesting, right? I love it. Data that make us go, right? So now we're all interpreting this together. So now we have, it's right around half, but slightly more than half did not floss. Slightly under half did. I'll unpack this again more, but think about back to our last question. Most of us, 54%, thought most did not floss, and indeed were correct, right? The perception, most people accurately perceived that most people in this workshop did not floss. Let me jump to another one. Do you think most people told the truth on this survey? Here's the next one. Just got 2 more questions. So thanks for playing with me here and for our experiment. It'll help us understand more. Do you think most people told the truth? What we have, and you can close it out whenever you see to do it here, Dave. So yeah, go ahead and end the polling. And what we've got are 3/4, 74% saying, yeah, I think most people here are truthful. You've got 10%, they're saying, nope, don't think so. 15% are like, I don't know these people. I don't know if they're being truthful on this survey. Okay, and then a final question. It's always interesting. Go ahead and ask this final question. Did you tell the truth on this survey? And give it just a little bit more time. It's pretty much almost everybody. You tell me, Dave, when you want to shut her down. End the polling. So go ahead, yeah. Okay, so 100% saying we did, right? So interesting. So let me just stay with this for just a minute, because it's like, I love to say things that make us go, right? Data, and it's like things to make us go, So this is interesting. We just covered a lot of territory in this fun little experiment around flossing. It could apply to a lot of other issues, though. It could apply to violence. It could apply to substance abuse and a number of things. But the first question we asked was a knowledge-based question. Do you know about this protective factor for this disease? Right? That was a knowledge question. Do you know of the protective factor? It's also a way of saying, do you know of the risk factor, right? So did you know that flossing can prevent disease? What we had was 90% of us said, yes, I have that knowledge. I'm aware of the protective factor. Stay with me, people. Do you think knowledge alone is enough to have us all flossing? I can see your faces. You can nod. Nod this way, because that's it, right? Right? No, we saw that. Do we think people should floss? Yes, 94% of us think we should. So follow me. 90% know it prevents disease. 94% of us think people should floss. That's an example of what's known as an injunctive norm. Injunctive norm. Injunctive norms are very powerful predictors of behavior. They're about what's right or wrong, should or shouldn't. And these have powerful influences on attitudes and behavior. 94% of us think we should floss. However, when we go to the perception, do we think most people floss because they have the knowledge and think that they should? Actually, no. Most of us perceived that most would not floss. 54% of us thought most would not floss or had flossed. 43% thought most had. When we go to the actual behavior, and what we find is about half, slightly more than half, did not floss. So interesting how this starts to unpack. And then we get into the reliability, validity measures. These are really cheesy ones I used, right? Self-report measures of truth or not truth. And that actually brings up some really interesting conversations. We do that a lot in schools too, with students thinking everyone lied, and we can actually show them through data that, well, that's actually not true. That's an interesting perception that we think that maybe people are, but people are often much more truthful than we realize, especially if their answers can't be traced back to them, right? anyways, really interesting things that we unpacked here. Knowledge, injunctive norms, perceptions of the descriptive norm, the actual descriptive norm, right? Some really important, powerful things. So let me ask you this. Now just coming back to our chat box, so what are some things you learned from this activity? What are some things that you learned? You can use your chat box, anything that sticks out to you.
There's a good comment in there from Sully. It's probably the same for any survey taken, or sometimes some would answer true or not, depending on what kind of questions are being asked. If it is a deep question, maybe some wouldn't be truthful or would be harder to answer, especially if our name is attached.
Yes, so let me jump in there and just say thank you for that. And that's really important. There are absolutely guidelines for administering or proctoring surveys or research where there would be conditions where people would not answer truthfully. They might be coerced. It could, for example, prisoners, often might not answer accurately because they could see that there might be some retribution coming back on them or something. So there's different reasons. Children answering using their parents' computer might be an example. But I like this, Chad. We should all over ourselves and each other, but we don't always do what we think people should do. That's brilliant. I love that insight. Yeah, the injunctive norms are flying around. Sometimes they impact us, sometimes they don't. And that's what's so exciting about this research. And Myra, yeah, knowledge doesn't always have that direct correlation with influencing behavior the way we think. Thank you. Interesting observation, even in our own data here, right? We all almost had the knowledge, but not all of us are acting on that knowledge. We almost all of us think we should as well, and we don't always act on that. So there's other things going on. So thank you, everyone. I appreciate it. So this helps us start to move into some of these next layers of positive commune norms and looking at unpacking perceptions, norms, misperceptions. We're going to kind of tiptoe into some of this. There's a whole body of science and research and practice here. But once again, one of the things we know is that what we focus on starts to become our reality. Okay, maybe that's a little overstated, but not really, because what we focus on to be real in our lives starts to become real in its consequences. We start to move in that direction. Something else that we start to see is we could really value from questioning our own perceptions. What we often perceive out there in other people as norms may not be accurate. So what do we mean when we think of a norm? Well, okay, this dates me. I'm sorry, I had to put this in. It really dates me. A place where everyone knows your name. And then I really had to go with this because we're in that whole time with COVID and everything, we're starting to look at new norms. Sorry, I thought it was funny. So anyway, great. So, but really what's a norm? It's like the perceived standards of what's acceptable, the shoulds or shouldn'ts, right? Or behaviors of what we're doing or not doing among a community, right? So it ties into our perceptions of what we should or shouldn't do and what's actually happening or not happening. Here's some examples of norms for work we did with, this is from statewide work in Minnesota. Everybody's states, I know there's a lot of different states, you all have some sort of statewide surveys that you're doing for surveillance of high school students, middle school. These are all norms. Just look at the numbers on the left, 75, 88, 91, 93. These are all norms because they're above 51%. They're 51% or more, right? If it's 50%, it's half, right? But if it's above 50%, it's a norm. 51% is a pretty weak norm, right? Especially if you're looking at a margin of error in any survey, which might be, plus or minus 4%, pretty weak. 93% is getting up there to a pretty strong norm, isn't it? Right? I mention this because the strength of the norm matters when we're thinking about using norms for messaging, and that's a whole conversation we might have. So what's the norm here? This is right across from Senator John Tester's ranch in Montana. I had to pull over, and it's out in the middle of Montana. What's the norm here, people? Right? Nice people, I know, right? But I have to ask you this. Let's say that the news stations flock to Rudyard, Montana, right? I don't care, pick your station, Fox, CNN, PBS. What do you think they're gonna say? So when the news comes in, they're gonna be talking about what? Sorehead crisis in central Montana, right? Right? They're not bearing down and going, wow, nice people. There's a story, right? Run it, right? No. So this is important to think about. Often news is focusing on things that are not the norm. No wonder there's times where things start to become skewed. And there's a lot of research about this, different groups that look at this. So this is important. A lot of times something is newsworthy because it's not the norm, right? And people that study communications, dog bites man, don't have a story here. Man bites dog. Okay, details at 10, right? Right? So we look at things that way. So that's important. It's important too, because now we're venturing into something that starts to look at public conversations. Different norms theories basically have this operating. There's a norm that's been measured. There's a perception of a norm that's been measured, like we did in our little experiment. And often there's a gap, which we experienced as well in our dental floss example, right? You following me? So this is often, it's not always this way. And sometimes we don't know which direction the norm and the perception or misperception are operating. But with a lot of these behaviors that we've been looking at, we, meaning researchers across the globe, like with youth substance abuse, for example, looking, especially over the past 30 years or so, some pretty consistent patterns. But one of the things that starts to become really important here, we already noticed it, it's not enough to just flood the airwaves with health risk and protection information, right? Information alone often doesn't change behavior. But what gets interesting is we start to mind the gap. We start to understand and unpack this a little bit more. The norm is that actual behavior or attitude that most people are doing. So you can see down in the bottom, the little box, this would be a way that we might ask it on a survey. And then the perception is looking at what we think most people in that group, most people in my high school, most people in my community, most people in the state of Missouri. That would be how we'd start to get at the perception. There's different ways that can be asked. Here's an example of a norm in Wisconsin. This was part of the study that I'm going to focus on here at the end here too, with the HOPE research when we were doing work here. Understand what's going on. The norm, most Wisconsin adults, this is from about 10 years ago now, most Wisconsin adults, 70%, strongly agreed that improving the well-being of children and families is important for healthy, strong communities. So the norm is what? 70%. Is there a problem or a concern that there's 30% that don't feel strongly? It could be, right? There could be. It'd be something to look at. Bop over to the other side. 72% of these same adults didn't think most adults in Wisconsin felt the same way they did. Follow me here. Most Wisconsin adults have this positive belief in strengthening families for strong communities, but most don't think that most other adults felt that way. Do you see how that is actually a misperception? I'm going to unpack some other things to help you see. State of Idaho, we were doing work with traffic safety. 86% is the norm, reporting that they had not driven a motor vehicle in the previous 60 days. That's how it was quantified. However, 89% thought that most Idaho adults had drank after driving in that 2-hour span. So stay with me here. 86% had not drank and drove, but 89% thought most had. So what's the big deal? Look at the blue line at the bottom. One of the big deals is that those that misperceive a risk behavior are more likely to engage in that risk behavior. Do you see it? In this case, it's 2.9 times in terms of how the risk ratio played out. Let me give you another example. This one's worded different backward. Several years ago, 88% of Wyoming adults either disagreed or strongly disagreed with the statement that it's a sign of personal weakness for somebody to receive treatment for suicidal thoughts and behaviors. They disagreed with that. So unpack this a little bit. The norm, in fact, is that 88% believe that it's okay. I'm reversing my language to help make it more clear, that it's okay and it's acceptable to receive treatment for suicidal thoughts and behaviors. I bring this one up because I think when we talk about stigma, I think there's a more complicated conversation we need to look at than we typically get into. I think a lot of times what we're talking about is our perception that stigma exists, but in a lot of cases, it may not be there in the way. We may have a lot more healthy attitudes for mental health treatment than we realize. So I want to plant a seed there that we have to dig deeper. And so I'm saying, whoa, does that mean we, the providers, might inaccurately see things? Yep, here's another example of that. West Virginia, safe sleeping with children. 70% agreed with, was a norm that babies should only sleep with safety approved cribs, right? So safe sleep, pack and play, those kinds of things. So 70%, the norm is that babies should only sleep in that safe environment. However, 83% of West Virginia parents did not think most parents would agree with that. And 97% of the home visitation service providers misperceived that norm. Interesting. Sometimes those of us that are engaged in the work have the greater misperceptions like we see here. And we see this a lot with first responders, police officers, ambulance drivers that often are seeing things in a very, very skewed ways. People that are focusing on substance abuse treatment are not often seeing the majority of the healthy population. What's this mean for us? It means that we often overestimate the amount of risk or harm, and we often underestimate health and protection. This is something very common. We often overestimate risk or harm in the environment, and we often underestimate the protections. Here's that social ecology word in action. What we can see in this case, 84% of students have never tried marijuana. So before we go any further, is it a problem that 16% have? Absolutely, right? Of course, we know that for all sorts of reasons. The earlier onset in involvement with substances, the greater likelihood for many different types of problems, including addiction. But look at the misperceptions. Again, here's the norm. 84% have not tried it, but 65% of most students thought most had tried it. Most students thought most adults had tried it. Spoiler alert, they had not. Most parents thought most students had, most school staff. So what do you think the public conversation is in this community around marijuana use in students? Everybody's doing it. It's out of control. How do you know? Well, just ask the students, the teachers, the parents, or the staff. And so what happens is we often get into an echo chamber of misperceptions, people. We start to check out our misperceptions with other people that have misperceptions. I don't know if you're following me. I know we don't have as much time to unpack it, but this is a huge aha for us in our research, that misperceptions of norms start to operate as hidden risk or protective factors. So one of the things that we can start to measure and impact are perceptions of norms as a way to impact attitudes and behaviors. So this is how we do it. These are some of those elements of that circular diagram. The positive exists, so we're going to uncover this positive. We're going to look for ways to uncover the positive norms that exist. But we're going to also measure gaps, because not everybody sees the positive norms that exist. In fact, like we just showed, in fact, oftentimes most people misperceive. Then we're going to come in and challenge those misperceptions. There's a number of ways we do it. Marketing and media could be a way, integrating it into our policies and social host ordinances, a number of things. And then that's when we can see the measured increases in health. Here's a publication that we can provide to you. Chuck, you could make a note of this. I could put this in their packet. The CDC commissioned me to write about positive community norms related to child maltreatment prevention. And this is a really short, user-friendly document, so I provide it for that reason. So that is a quick tour into positive community norms. At the end, we might have some opportunity for some question, answer, and dialogue. But the key point some key points I want you to remember are these. There's more going on to influence behavior than just knowledge about risk or protection. One of those things that we need to focus on is actually norms, and not just behavioral norms, but also the injunctive norms, the shoulds and should nots. And we need to look even deeper, because we often misperceive those. We're not seeing things for what they often really are. We saw that with our dental floss example. We see that with some of these other data that we looked at. In fact, the pattern is that we often overestimate risk and underestimate the green arrow or the protections. And so some of our work becomes actually correcting those misperceptions of norms. That's some of the essence of the positive community norms approach, and then what we would do to strategically change behavior by correcting those misperceptions. And I can include some articles related to that. I do want to make sure I've got some time to move into this next element, which is about HOPE, which is also an acronym for Healthy Outcomes from Positive Experiences. So once again, we're doing a whole workshop on this tomorrow. I'll be doing it with some of my colleagues from Tufts University School of Medicine, where we've created a center in this past year, a HOPE Center, to disseminate these materials. So we'll make sure you have links to the center, and then you can attend the webinar for those of you that are tomorrow, where we're going to unpack HOPE. So this is going to be a bit of a spoiler alert for some of what we'll go into deeper tomorrow. But bottom line is, if we stay with this paradigm, with the science of the positive paradigm and public health, of looking at growing protections and reducing risk, those are two different ways we could look at things. Now we can unpack it a little deeper. I want to ask you this. Go ahead and jump in your chat box. How many of you have heard of or are familiar with ACEs, at the Adverse Childhood Experiences Study? I'm just curious. How many people have heard of that?
Nothing but yeses. They keep rolling in.
That's awesome. Yeah. So yeah, from the last 20 years, 22 years, I guess, looking at that really important research, that we know toxic experiences impact a young person's brain in ways that sets them up for health problems later in life. That's the quick version. We know that. How many of you are familiar with PCEs, which are positive childhood experiences, which is the newer research that we're doing through the Hope Center that we're going to uncover? Yeah. Oh, that's great. So a lot more variety here. This is awesome. Good. I love it. Perfect. So I'm going to just give a little bit about that. So the bottom line is that if ACEs is looking at the risks related and outcomes, negative health outcomes from negative or adverse or toxic experiences, PCEs is saying, wait, if we look through the lens of the science of the positive, wouldn't it hold that positive experiences are also shaping the brain and experience of children and carrying that on for greater health likelihoods? Spoiler alert. That's what we're going to find out more tomorrow. But yeah, it starts to rewrite this narrative. So in the past, we've looked at it this way, that adverse experiences based, through toxic stress have these increased negative outcomes, right? And here's all of the different things that, since all of you are aware of this, I don't need to hang out here for very long, that we know that the more of these ACEs, the more of these adverse childhood experiences that we have in terms of an ACE score, the greater likelihood that you're going to have these negative health outcomes as an adult. But what if we started to look at and flip it and look at it differently? And this is exactly what we did and started doing with some of the work we were doing at the CDC a few years ago. I was a member of a 3-year think tank that was involved with some other people. And one of the things that came out of that was we started to look at it this way. And this was the first publication that we published. And Chuck, let's make sure that we send the publication itself and links to people to, after this. And then tomorrow we'll make sure that everybody has this as well. But here's something we'll unpack more tomorrow that is more recent research. We published this a year ago. And here's what I want you to see. To just get your head around this. So once again, the more ACEs that a person has, the greater likelihood that they're going to have negative health outcomes, right? So now what we started to look at is what happens if we see increases in positive child experiences, PCEs, what effect does that have? So we looked at the issues with depression and poor mental health. And and here's how we can unpack this. So that again, going across the bottom, here's the increase in ACE scores, right? This means more and more ACE scores as we go across. And then if we start to look at what are the mitigating effects of the PCEs, this is what we start to see. Basically, when we look at greater number of positive childhood experiences, you can see the dramatic reductions in the health outcomes that show up from the higher ACE scores. Pretty profound stuff. Absolutely. This is, we're incredibly excited about it. It's starting to gain an enormous momentum in terms of some funding and some impacts. The state of California, for example, is completely remobilizing and starting to think differently. Instead of just looking at trauma-informed care, we now look at hope-informed care. There's a whole other side to the equation, right? So now we rewrite the story. Now we rewrite the story. It's not just adverse childhood experiences and toxic stress mean poor health outcomes. if we start to have positive experiences along the way, they can mitigate those effects. And every one of us knows somebody, might be ourselves, that have had adverse childhood experiences, but have also had positive experiences and somehow turned out okay, right? It's a basic way of saying it. We know people that have had very adverse, unwanted experiences and have also had positive experiences that have mitigated those. So this is more of what we'll unpack tomorrow. But the big takeaway is our adversity doesn't fully explain us. We're so much more than our trauma, right? And this is where I believe if we're only focusing on the red arrow side of the equation, we're missing out on something incredibly powerful. The whole science of the positive side of it by looking at the green arrow. There's this whole positive side that we need to help explain it. And healing and the solutions are already there in ourselves, in our relationships, our communities, our cultures. The positive already exists. And we need to share that because we are the medicine with each other, right? We are the medicine. It's in our positive relationships. And so we can start to rewrite that story and look at hope-informed care and hope-informed outcomes. And I'd like to do this. First of all, just jumping into the chat box, I would love to know, what are some of the ways that you might think about applying some of today's teaching in your life or your work? What are some of the ways that some of the things you heard about today might be useful to you? Dave, I'll let you go ahead and mention some of these if you would.
Certainly, certainly. All right, so looking at the positive norms and focus on those to mitigate the negative perception of norms. There in St. Louis County, they're currently working on a positive community norms campaign, changing the focus of primary prevention for childhood drug overdose program to PCEs versus ACEs, strength-based. All right. And Susan's encouraged to see research is backing up what I've thought about the power of positives for years.
Good. Yeah.
Yes. Grocery bag inserts with positive norms.
Oh, I love that.
All right. Risk and protective factors to a specific problem and not the overall prevention effort. Getting specific. All right. Chad's thinking about how this might relate or not to social determinants of health.
Yeah, absolutely. I think that's some of the next directions of where it needs to go. Tomorrow, we're going to begin to explore, there's what's known as 4 building blocks of hope. 4 building blocks of hope. And one of those starts to get into exactly that, Chad, in terms of safe, stable, nurturing, equitable environments. It is one of those building blocks that's emerged in the research. I too like that idea of our neighbors being the best medicine. I just love the fact that it's our relationships that really are important. Yeah, applying ACEs with some other information. Yeah, at a next level. Nicole, I love that you started a podcast for parents on building voices of resilience in youth and their internal dialogue. I love that.
Yes.
Hear examples of what that sounds like. I think that is so powerful. You're creating and cultivating the positive resilience there. That's lovely.
Where can we subscribe to that podcast, Nicole?
Yeah. Yeah, perception, being a monster, social media, out of control. Yeah, I think that we are now at a place of having to build competence and mastery in media literacy and what we talk about in terms of positive norms literacy. How can we make sure that we ourselves and training others like youth to be able to navigate those environments? Those environments aren't going away. they're going to continue to grow. So we need to become more competent in how we can navigate those and have skills in those. So thank you. These are great. Laura, I don't have an answer on your question. I love your question about Bruce Perry's research and the timing of early life stress and its impact on lifespan health. I think we're just starting into some of that. The HOPE research that we're doing, that I've been involved in, it's fairly new, but I think that I'd like to do a shout out for one of the co-researchers, Dr. Christina Bethel at, she's at Johns Hopkins University. I think some of her work around thriving in early childhood work she's going to have more to be able to answer that question than what we've been able to do. So I think that looking at some of the Johns Hopkins research might really help there. So I just want to say thank you. This is really amazing. Chad, thank you about what you're saying in terms of positive intent. I love your comments, finding that balance. And I'd like to stress that too. Some of the ways that we start to work with this in our teachings, we start to look at balancing or integrating hope and concern in our communications and in strategic communications. I'll put that as a plug, Dave and Chuck, for a potential next training too. That's something that people have often wanted was, so what do we do with this? How do we start to bring this forward? And that might be something that we do. We've done that with some of the other PTTCs as well. So that would be something I'd love to put out there. So this is what we did. We did a quick skim through science of the positive community norms and hope, and then just a quick reflection on integrating some of this into our lives and our work. And I want to thank you. I know that you all have a lot of screen time these days. We all do. And for you to take time out and just be a part of this, I just want to let you know I'm grateful, and I'd love to be able to explore this more with you through the work that we're able to do at Mid-America PTTC. And that's what Dave and Chuck want to do, is they want to hear from you about what resonated from you, what you'd like to hear more of. And we're good friends and colleagues, and I'd be honored to continue to be involved. So I'm aware that we often go to the buzzer, but it doesn't give us enough time to transition between meetings. And so I'd like to go ahead and just say we signal off now, and we could, Dave, if it's okay with you, we leave I'll go mute. You can do whatever you need to say here, and then maybe leave the chat box open. So thank you, people. See some of you tomorrow. It's an honor. Thanks.